So thank you very much for the introduction and inviting me to deliver my talk. So hopefully I'm audible.
Yeah, it's okay in this moment.
Okay, thank you, Laura. And today I'm going to talk about climate neutral biosensing for healthcare. I'm Dr. Anshuman Mishra, uh, Harvard Gitter Group leader from Institute of Advanced Material, IM Sweden. So my talk will cover climate neutral research, biocompatibility, background of the nanoglasses, advanced biomedical technologies, like how we can understand it, how we can adopt all these biomedical technologies, and what are the important impact of these biomedical technologies in current scenario. So how we can understand climate neutral biosensing, what is the sustainable prognosis model, and what is the roadmap of sustainable healthcare management. So, firstly, I would like to start from Sustainable Development Goal, which is started by United Nations from 2015, where they fixed the agenda of 2030 sustainability development, where all the nations have signed and they have to fix on goals where they have to work on these 17 uh, fixed goals. Or means you can see like poverty, zero hunger, good health and well-being, quality education, gender equality. So all these 17 goals, all the nations, all the research organizations, all the individual to uh, country level, everyone has to work. And recently in Paris Agreement, they also adopted that they will also work to decrease the temperature of the earth by their research methodology, by their process, so that global climate burden can be tackled. So if you talk about the net zero carbon neutral goals by country, you all can see that how all the countries is participating, from the American continent to Asian continent, African continent, European continent, how they want to involve in developing carbon neutral goals by developing net zero technologies, so that they can achieve the goal as soon as possible. Definitely net zero, how we can achieve if we avoid any kind of carbon emission, how we can reduce the greenhouse gases, and we have to invest, we have to uh, involve in industry where we can remove the carbon, and how we can involve in research technology innovation where we can develop green technology, we can work on big data, social movement, everything, so that we can achieve this net zero as soon as possible. If we talk about different kind of dynamic biological interfaces, you all can see that there are many parameters like pH, enzyme, strength, magnetic, electric, light, temperature. All these things can be used as a interfaces where we can sense any kind of biological molecules or samples, where we can understand and sense them. Same way, if we talk about biocompatibility things, how we can make any kind of materials, either inorganic or organic, like here you can see paper, glass, silicon. All these things can be make biocompatible, and they can be used in some kind of healthcare management or healthcare field, like in kind of diagnosis or treatment. So we have to adopt a material which is climate neutral, which is less toxic, which is not harmful, which can be degradable. Therefore, we have to avoid the plastics, we have to avoid the toxicity, we have to see the any kind of develop any kind of medical device or implementable device, dental materials or products which can be which have less burden on the environment. So you can see the advantage and disadvantage of all kind of materials where we can choose based on climate neutral things. So whenever we talk about the development of any kind of materials which can be used in the healthcare field, we have to see the how what are the important property that material can bring. So material should be have transparency, their price should be less. They can be sensitive and specific to detect the any kind of biomarkers. They have some kind of permeability property, mechanical related strength, toxicity related things, so that it not be toxic for our body. So all this kind of uh, properties can make any kind of material a best biocompatible materials. So if we talk about the nanoglasses, which has some mechanical behavior, magnetic properties, electronic, thermal stability, can be used in tissue engineering, can be used in therapeutics. All these things make one of the excellent material to be used in the healthcare field, because nanoglass exhibit excellent mechanical properties such as improved plasticity, hardness, elastic molecules, when you compared with their corresponding melt quench behavior. So all these things make it one of the important uh, materials which can be used in the medical field, chemical field, and physical field. If we talk about the medical field, we can sense, we can make develop device because has anti-infection properties also. Same way in the chemical behavior, it has luminescence, electrochemical, ion conduction properties. If we talk about the physical behavior, it can be used in cryogenic things, magnet dielectric property, it has superconductivity. So all this property make it a important material to develop medical devices. So if we talk about the population variation, so we can see that this is one of my study which show that how human behavior, how population behavior, we know that world is divided from uh, different they carry biodiversity. Biodiversity, they carry phenotype differentiation. If we talk about the human, you can see color is the one of the striking phenotype feature by which we can differentiate the human from black color to white color, how human races are spread, how they are adapted in different kind of environment so that they can take adaptation of specific color for a particular environment and location. So these kind of phenotype character is related to their genetic background. Same way, if we talk about the drug, so when you see the cytochrome oxidase P40, 50 enzyme, what we have found that genetic polymorphism of cytochrome P450 2C9 in Indian population, what we have found that persons are subject having 3 allele, they require lower dose of warfarin compared to 1 and 1 allele. So this kind of study show that each population have unique feature to digest, to uh, work for a particular amount of drug, because each population is adapted, they have carrying their specific genetic pattern, which can be used for their metabolism, for their digestion, and for their specific response to any specific drug or any specific chemical compound. So we cannot use same kind of drug for each population. We cannot use, maybe some drug is lower amount is sufficient, some population has higher amount sufficient. So this kind of study is useful to identify which population has which amount of drug we can use and which amount we can use, so that we cannot take toxicity in our body. So same way, when we talk about the biomedical technologies adaptation, we have to understand the multidisciplinary research. We have to understand which kind of technology we can adopt to develop a healthier healthcare management. So definitely there are research on database resources, different kind of research in treatment and vaccine technology, and how we can develop diagnosis and treatment model. We have to understand the green chemistry and analytical method. If we talk about the advanced technology, we can see that multidisciplinary research like genomics and proteomics is one of the topmost field, which give lots of information about complete background of genomics, genetics, and all the proteomics, and through which we can understand different kind of biomarker, different kind of risk associated with the individual. Same type, if we develop some kind of sensors connected with electronics, so that we can convert in some kind of uh, informative tool, then through the use of digital technology and AI cloud based computing technology, we can decrease the cost, we can do the monitoring of healthcare thing, not only individual basis, but for a mass level, for a big population. So after COVID, everyone know that cost effective technology is one of the important tools through which we can give immediate and cost less cost solution for all kind of populations. So if we understand the genomic phylogeography of any kind of emerging bacteria or virus or any kind of pathogens, then we can make a very important tool for their diagnosis. Then we can uh, develop a very cost effective diagnosis tool by studying their genomics, by studying their uh, genetic marker, and in early stage we can identify the risk, and then we can make their control strategies. Same way, if we work on different kind of population, regional population, and then we can identify any kind of health related concern Like here, all these studies, like there are some kind of population, they have a uh, societal tendency. So this is one kind of example how our mental status changes in a specific kind of environment. Same way, how obesity, like lifestyle diseases, diabetes, cardiac, all these things increases. So whether this is related to our food habit, or whether it is related to our genetic background, so all this kind of studies can be done through genomics-based, population-based research, and how we can develop a very cheap and very cost-effective devices. Like if we talk about the paper-based analytical device for sensing, then we can add climate control methods in our system. If we talk about the paper-based analytical device, you all can see it can be disposable, less cost, easy to prepare, very flexible, easy to modify. It can be used in drug screening, clinical analysis, food analysis, environmental analysis, and healthcare. So why not we have to avoid the plastics devices and make all kind of diagnosis device in paper based. And if we talk about the organ on chip technology, there are lots kind material like synthetic material, hybrid material, natural material. So definitely we have to choose adopt natural material like collagen, gelatin, fibrin, hyaluronic acid, ketosine, alginate. All these things can be very biocompatible, and these can be used to develop the device and cause less harm to the environment. So recently we have seen lots of advances in organ on a chip material and their devices, because these can be used in the IoT enabled devices also. They can be used connect with the smartphone, and by this way we can develop organ specific device material. We can do the monitoring also, real time monitoring of healthcare thing. So particularly a lifestyle disease, particularly cardiac, kidney related, liver related disease, we can uh, very effectively we can control and we can monitor the disease. Like here you can see that nowadays microfluidic chips are developed which can be used in skin on chip, gut on chip, heart on chip, lungs on chip, tumor on chip, liver on chip. So all this kind of things, by using a different kind of natural material, they can develop this kind of duplicate organ kind of devices, which can develop, which can produce enzymes, which can use for the treatment of the human organ. Same way, we all know that nowadays digital technologies are very useful, and these kind of technologies are very useful for the diagnosis and treatment. This can be used in a telemedicine. So therefore, we have to understand the power of all digital technologies, wireless healthcare systems, which can be used for early regular monitoring and early diagnosis of any kind of disease. Firstly, we have to understand the risk, what are the relevance, and what is the important roadmap for any kind of sustainable healthcare model. And we have to understand their policies, their strategies, what we can include, what we can adopt, and how we can use that in diagnosis, which kind of method we can use, and how we are monitoring the any health and challenges, and what is the important thing which we can develop for a prevention policy. So all this kind of roadmap we have to develop on a regional basis. We cannot adopt North American policy, North American strategy, adaptation, diagnosis thing, monitoring, prevention policy in South America. Same way, whatever adopt in South America cannot be adopted 100% in African continent, or whatever the we are using in Asia, we cannot adopt in any country. We have to work on regional basis. We have to understand all kind of risk. We have to understand the challenges, and accordingly we have to develop our diagnosis and treatment plan. So sustainable management, healthcare management based on regional healthcare model, regional strategies, and how we can work effectively on molecular, cellular, and environmental control methods. We have to develop on regional basis. So if we talk about the prognosis model, which address diagnosis, treatment, and control, so we have to adopt a phenotype-based technologies, which can be useful to identify any kind of risk. We have to use natural and traditional plant-based materials and medicine for any kind of treatment so that it cannot harm our body. Same way, we have to use digital technologies, different kind of vaccine and sanitization methods for healthcare monitoring and healthcare control. So overall, balanced environment and justified socioeconomic can be used for sustainable prognosis model. So overall, my conclusion is that healthy life exemplified by better healthcare management and recent technology development along with eco-friendly prognosis aspect is best strategy of any kind of issue. And eco-friendly biomaterials having physiochemical properties broadly exploited in numerous fields including biotechnology, medical and dental field. And remarkable advances led them to develop different kind of wearable, implantable, and automated devices for monitoring and pre-prognosis strategies, and definitely climate neutral products, which cannot affect any harmful effect on environment, will reduce the cost and risk by eco-friendly method, and thus risk of transmission and infection prognosis can be controlled. So these are the important international pre and post PhD program by our institute. Our institute facilitating partnership with global R&D world links. We have a networking, finding solutions, creating collaborations, intensive discussions, mapping out future, generating result, and any kind of call, international project or call through consortia we are developing. So you all are welcome to our Institute of Advanced Material IM. We have a very climate neutral campus and laboratory. And we have also robotics and AI based labs. So we have a very good field for a globally climate neutral research lab. We have a biodiversity water eco sites where we can work with international students on different kind of project. We also actively participate in United Nations related programs, and our team regularly visit. And recently we participated in water conference, United Nations, where we work with the United Nations Sustainable Development Agenda 6. So thank you very much. And